Well, spring starts Monday and soon temperatures will start to warm up and we'll begin seeing green grass again. But that doesn't mean you're in the clear when it comes to catching the flu. In this week's Your Community Health, WENY's Renata Steele talks with an Arnott health doctor about how you're still at risk of flu this time of year.
Hello and welcome to Your Community Health. I'm Renata Steele with WENY and I'm talking with Dr. Richard Terry this week. And Dr. Terry, we talked about the flu earlier in the season. Now we are approaching spring. We want to revisit that topic and kind of see what are we seeing in the community as we get into the warmer temperatures. We want people to know that, or the question that I have is, are you still susceptible to catching influenza, even though we're getting into that springtime time of year?
Well, that's an excellent question, and the answer is a resounding yes.
Okay.
We are seeing that. Just last week, I treated a patient who had the flu, and unfortunately it progressed, and she went on to develop a pneumonia, ended up being hospitalized.
Oh, goodness.
Fortunately got better and has gone home since. So the answer is yes, you can still see it. And even if you've been vaccinated, I think sometimes folks, well, I got the vaccine, I can't have the flu. Well, it's not a perfect match. Mm-hmm. Maybe 50% of the time we've hit it right, but 50% of the time we don't. And you can still get a strain of the flu, which may not have been covered with the immunization.
And I think that's important for people to know, too, is that the flu vaccine isn't an end-all, be-all against the flu. There are so many different strains that the people who formulate the flu are trying to kind of anticipate which versions are going to be out there any given year, correct? And some years they're right, and some years the flu kind of throws a curveball at you.
Absolutely correct. And I think this year, it's been maybe 50-50, but you can still have those symptoms. And what might they be if one gets the flu? Well, typically it's a fever. It can be a cough, but most characteristic, which will differentiate a typical URI or upper respiratory infection from an influenza infection would be the myalgias or muscle aches, diffuse muscle aches all over. Very characteristic, along with a high fever, cough, perhaps rhinorrhea, runny nose, headache. Sometimes you can even get gastrointestinal-like symptoms with the flu as well. So those are the symptoms. Who's really vulnerable? Obviously pregnant women and the elderly and children, particularly children less than a year old. So those kind of symptoms, get them to see your healthcare professional. Most of the time it is a self-limiting disease. Means it's going to get better on its own. But if you're in any of those high-risk categories, have a chronic health disease such as diabetes, any other condition which might affect your immune system, there are medications we can sometimes start within 48 hours that can help ameliorate it a little bit, maybe lessen the symptoms and shorten the duration. Otherwise, it's pretty much supportive care and self-limiting.
Yep, just one of those things that you kind of have to get through in some cases.
I'm afraid so.
All right, well, thank you so much for checking in on the flu with us, and I hope most of our viewers have gotten through the season without contracting the flu, and if you did catch it, we hope you recovered quickly. We'll put some more resources and information about influenza on our website, WENY.com. Thanks for joining us for this week's edition of Your Community Health.